my name is Charlotte Smith. Today I will perform a partial neurologic exam on my patient consisting of the 12 cranial nerves as well as a few of the peripheral reflexes. To test cranial nerve number 1, which is the olfactory, you would do this by having 2 to 3 valves with different scents in them, having your patient close their eyes, occlude one nerve at a time, assessing both, and have them identify the smell. It could be peppermint, orange, something like that. To test cranial nerve number 2, which is the optic nerve, we would do this by the use of the Snellen chart. To test cranial nerve number 3, which is the oculomotor, actually you can test 3, 4, and 6, the trochlear and the abducens, which is 6, all together, because they all have to do with movement, lateral movement, and pupillary response of the eye. So you would do that by using your pen light, checking both eyes, the pupils, making sure they're both equally round and reactive to light and accommodation. Cranial nerve number 5, which is the trigeminal, you would have your patient clench their teeth and assess the muscles there. Okay. For cranial nerve number 7, which is the facial, you would assess the facial cranial nerve through a series of expressions with your patient. So you can have them open their eyes real wide, close them real tight, raise their eyebrows, puff their cheeks, and purse their lips like you're whistling and blow out. You can also use a cotton ball, which I don't have, a paper clip. You're also testing the senses. So you have them close their eyes, and you could use each and have your patient identify according to touch. Number 8 is the acoustic cranial nerve. You would have your patient identify sounds that they hear. You could use snapping. You can use the tuning fork for sound and vibrations. And you can also use the Rumberg test. So you have your patient stand up, assessing their balance and equilibrium. So you can have both feet on the ground, or you can have them do one at a time, close their eyes, and you're just checking their equilibrium. Swaying is normal a little bit, but your patient shouldn't fall over. Okay, let's see. So that's 8. Cranial nerve number 9 is the glossopharyngeal. So you would assess your patient as they swallow. Take a little sip there. There we go. You also assess the voice. You can have them say ah. So number 10, that's vagus, the vagus cranial nerve. We will assess the gag reflex. I don't have a tongue depressor, but you would stick the tongue depressor towards the back of the mouth, and it should elicit the pharyngeal muscle to contract. Cranial nerve number 11 is the spinal accessory. So you would have your patient shrug their shoulders up. While you apply a little resistance there, you're assessing the trapezius and the sternocleidomastoid muscles for size, shape, strength. Number 12 is the hypoglossal cranial nerve. So you're assessing the tongue for movement, for strength. I would use my tongue depressor, have your patient stick their tongue out, and put a little resistance there, also moving from side to side laterally, checking strength. So that concludes the cranial nerve assessment. Moving forward to our peripheral reflexes. There's a few of them that we could do. I guess I'll use this arm. We could do the brachial, I'm a lefty here. Bend 45 degrees there. We could use the brachial radial. We could also use the, we can go to the patellar. You can come around here. So for the patellar tendon, you would strike below the patella, and it should cause the leg to extend like so. There are a few more that you could use. You can do the Achilles, you could do the plantar, checking for Babinski. So this concludes my exam today, my neurologic exam. Thank you.